that happen in the emergency room that usually don't happen, hopefully, anywhere else. Is that better?
Yes.
What are things that happen in the emergency room?
Legal blood draws, violence.
Quit reading. What are legal blood draws? Who brings them in? The police. What has happened?
They committed a crime, probable cause, and they have a, what is it called?
They bring in this little kid, and they ask the nurses to do what?
Applied consent.
Right.
When you drive a vehicle.
Can whoever they bring in refuse to have their blood drawn? Yes, they can. It is an immediate go to jail, do not pass go, do not collect $200. You can refuse to have your blood drawn. It is immediate go to jail. You can say, yeah, I want to do it. When you get to the emergency room, you can refuse, you immediately go to jail. It's their right. When you are drawing their blood, what do you not use to clean their skin? Alcohol. Alcohol. I was drinking alcohol when I ran over somebody, so don't clean their skin with alcohol. You need to be very careful. If you are, guys, if y'all are a student, don't do this. I'm telling you, don't do this. This is a legal. I'm not saying you couldn't do it. Don't get involved in this. If there was a court case, I don't want you going to court. You have to follow very, 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 very specific things. And if you didn't do something right, I don't think you want it on your conscience that somebody didn't go to jail, that killed somebody. Now, if somebody's going to draw this, by all means, go in the room to see. But there's a whole lot of stuff that goes into this. Rape kits. What are the nurses called? Sane nurses. Not insane. Sane. Sexual assault nurse. Examiner. Yeah. How many do we have at Denova? Or when I stopped working there, we had none. Because the lady that was training left. And so they told us, hey, y'all are going to have to do it. Guys, I've never done a rape kit. How important is that? Violence. If you're at Denova, what's the code? They'll call overhead. Y'all need to know this. Mr. Atlas. Y'all need to know that. Who's at Skyline? I don't know that. What is it? If you don't know it, you need to figure You need to figure it out the next time you go to clinical. Guys, this is important. What's active shooter? I don't know Skylines. A gun is silver. The next time you go to clinicals, find that out. If there's an active shooter, you need to know there's a gun in the building. And what should happen? They should lock it down. Is it always the patient? Who might it be? Who else?
Employee.
Guys, y'all think staff ain't got into fist fights? Show have. They still will call a Mr. Atlas. Families, when the husband's there and there's a woman in there with him that I thought was the wife, and then the wife walks in. We had to drag her out of the room. Yeah. I was like, can we just let her go for a minute? You were talking about neglect earlier. We're not stereotyping, we're not whatever you want to call it. If you see something, if you suspect something, you have to speak up. We brought a child in on Lifeline, and it was something, I don't remember what it was, when we took that child's clothes off. There were so many bruises in different stages of healing that don't just happen. If the story doesn't match, if a 2-year-old, which what starts happening at that age, stranger danger, right, runs over to you and leaps in your arms. Now, every now and then that happens, right? They just love everybody. And leaps in your arms and says, please take me home with you. Unless they're just real friendly. I fell down the stairs. And you have a burn. If the story doesn't match, there is nothing wrong with going and talking, going and talking to your preceptor, going and talking to the nurse you're with. If ain't nobody else around, go pull the charge nurse aside. What if you're wrong? Okay. And what if they're like, damn student nurses? You go up to them, don't be a butthole, and you say, I'm sorry, Steph. You know what? I'm always caring about my patient, and I have their interest first and foremost in my mind. I'm sorry you don't. And just walk off. Do not, never, 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 never at a clinical site be confrontational with somebody. That's my job. That's your clinical instructor's job. They will kick you out. If you get in a fight with a nurse, I have to come up there and give you an unsat. Don't do it, okay? Let your clinical instructor handle it. All y'all's clinical instructors been there a while. They'll handle it, I promise. What kind of animals?
Wild rabbit.
It don't matter. Dog bite, cat bite, well, especially wild animals whine. Rabies. What if it's a stray dog? What are they going to do with the dog? They have to quarantine the dog. If it is somebody's pet and they don't have rabies paperwork, they're still going to quarantine the dog. I think it's either 7 or 14. Does anybody know? 7 or 14 days, something like that. If someone is bitten by a bat, immediately they're given the rabies shots. Those shots are not pleasant. They're given into the wound. And usually it's more than one.
Can you numb the area first? Or they don't really do
We
that?
did.
Okay.
I've only given them once. And thank God it was a grown person. What kind of animals besides bats usually carry rabies? Raccoons, possums, foxes, I think squirrels can actually carry it, but bats are the number one. I think they actually carry it, just carry it. Certain infectious diseases, TB is a big one. Rabies. What else?
Measles.
Measles. STIs. There's one big one though.
Ebola.
Definitely. West Nile. Why are these reportable? They're very important, right? How many people had COVID? I had it 4 times. Did anybody call y'all? Girl, they called me, and they asked. I don't know if it was, well, it was in the beginning of COVID, so at the end they probably didn't care. Syphilis is a big one that they worry about. There is a website that you can go to that talk about infectious disease that are reportable. Violent crimes with and without weapons. And it doesn't matter if it's a knife, a shovel handle, an axe handle, a machete. So I found out a machete is a chopping weapon, not a stabbing weapon. She walked in and called her husband, went out and got the machete and stabbed him. And we thought we were going to get a sucking chest wound because she stabbed him in the box. So we got the chest seals out. They discharged him an hour later. It was that deep. I was like, sister. What?
You did it wrong.
I know. Come on. So, I think it's either 2 or 3 years ago, they changed the NCLEX. Do y'all know why?
Prioritization.
No. Why did they change it?
Shortage?
New evidence-based practice.
What'd you say?
New evidence-based practice.
Guys, they had been studying this for like 8 years. Do you know what they found? We were turning out nurses, what? That could not critically think. What did I tell y'all that I thought my job, I thought this was before that? To help y'all to figure out how to think. If you can think through a problem, you can take the NCLEX and pass it. Because you can think through that question. That's why this big push to go through a scenario and figure out what's important. Because then you can walk in that room and look at that patient and be like, hey, their O2 sat's 88. Oh, they're wheezing. This is just like the scenario that you're writing. Can I look at that patient and figure out what's important? We were producing nursing students that didn't pick up on those cues, that couldn't do the assessments, and that couldn't do the interventions based on the assessments. Do y'all see what I'm telling you? This lecture used to be about emergency, triage, ICU. When me and Dr. Wilk inherited this, I looked at her and I said, you know how much emergency is on the NCLEX? And she was like, I said, not one damn thing. Because I asked all the classes, and I'll tell y'all too, after you take the NCLEX and the PTSD has stopped, I want you to come back and tell me if you can remember what it was heavy on. The first semester after the next gen questions had come in, I had 5 students that came back and said, oh my God, I'm so glad you taught that because it was so heavy. Guys, this is not primary, secondary survey. This is prioritization. It is different. And I had to completely change gears because I was trying to teach y'all emergency. This is not emergency medicine. It is kind of the same. It's ABCs. I am not teaching y'all interventions. Not really. Kind of. As we go through this. This is prioritization of everything. How do you figure that out? Critical thinking. What do we prioritize? Lord have mercy. Why? Besides critical thinking. Why do we have to prioritize?
That's not.
We don't want none of our patients to get yeeted to Jesus. Y'all, please don't chart that the baby got yeeted out. That was my paramedic student, and I swear for God that he charted the baby got yeeted out. I took him back his chart. I said, "One, you can't write this. Please rewrite this chart." We don't want the patient to get yeeted to Jesus. Y'all have got to figure out how to manage your day. Do you think your patients are not going to change. So I've had people say, "Yes, Lord, I'm going to work on med surg. I ain't got the hell you don't." What is a RR? Rapid response. What drives that? Prioritization. Changes. And you walk in and you have to look at cues. You have to do an assessment. Oh, they're not breathing. Declining patients. See, number one, I don't want my patient to get yeeted to Jesus. It's on the NCLEX. Guys, it is not. They ain't gonna give you a question that's like, the patient has stridor. What are you gonna look? Which one are you gonna choose? It is not cut and dried. They probably are not gonna give you a question that involves the ABCs. They might give you of the following patients. Which one are you gonna see first? You got a patient that needs a breathing treatment. You got a patient that needs a blood pressure medicine. You got a patient that needs a stool softener. It's still ABCs, but it's meds. If you had an EKG, blood pressure medicine, and doc you say, EKG, you still use the same things. Then you think about it, if I don't do nothing, what's going to happen? Well, cardiac arrest. That one's priority. That one, I'm going to pick that one. What? Y'all just go ahead and say it. What do we prioritize? Everything. Yep, just go ahead, everything. But patients, orders, these are the type questions they're going to write on the NCLEX. Patient comes into the emergency room. You need to do the following. Which one of the following are you going to do first? You're going to do an EKG. You're going to put them on the monitor. You're going to put a gown on them. You're going to give them nitroglycerin. What are you going to do first? Who says which one first? EKG? Who said nitro? Who votes nitro? Who votes EKG? Nitro? Who votes EKG? Why? Assessment before EKG. Their blood pressure's 80/50. You just killed them. Assessment before intervention. Doctor tells you, hey, go give room 2 that blood pressure medicine. You gonna go give it? No, I'm checking that blood pressure. Hey, go give room 2 metoprolol. You gonna give it? Better not. Not without checking that heart rate. That's a few slides from now. That's another prioritization tool. It is a nursing process, but we kind of threw all that other stuff out. It's still important. Y'all know something funny? When I started teaching with Dr. Wilk, I was like, I don't know how to do my PowerPoints and prioritization. She's like, the nursing process. I looked at her. Y'all know why I looked at her? It's not that. I came directly from teaching paramedics. Guys, y'all know I'm paramedic. It's no different. It's one's not better, one's not worse. It's just different. I have to teach them different. I thought through this. I just never wrote it down. And I'm like, she's like, you don't know what it is, do you? I'm like, I don't remember. We prioritize meds. We just gave you an example. A breathing med before a blood pressure med. But their blood pressure is 200 over 150. If they got stridor and their O2 sat 65, we ain't gonna get to C because they're gonna quit breathing. And then we gonna get to C because it's gonna be CPR. Tasks, procedures, lunch breaks, hiding in the linen closet, everything. You have to prioritize everything to make your day halfway okay. a friend of mine works at Skyline in the ICU, and you get moved sometimes. They move them to med surg. Guys, I'm not above working in med surg. I told her, I can't do that. I would be lost as last year's Easter egg. If I had 8 patients, I would be so damn far behind. I mean, why? I'm used to taking care of 2 patients. I don't know how to prioritize that. You have to give meds to 8 patients. I give 2. Well, Miss Horton, they're critical. Yeah, I got 2 patients, not 8. I've never done that. She has worked med surg before. So she goes there and she's like, I do this. I'm like, oh my God. What's the worst thing that can... Don't y'all ever say that, because then you're going to hear this. What's that mean? Fuck around and find out. Y'all don't ever say that in the emergency room or ICU either. What's the worst thing that can happen? You're going to be gang tackled.
Shit always ends.
Right. All bleeding stops eventually. I know these tests are not real world sometimes. I get it. I love y'all. I really do. Y'all get so deep in the weeds sometimes, I want to shake you. And it's always my amen students.
Yeah.
That's fair.
But y'all push yourself so hard. And I get it. I do too. And you always shoot yourself in the foot. Do you know why? What do you add into every question? What if? Guys, you're going to fail your first test if you don't stop that. This test, every question you need to take at face value. Period. If you read that question, you're like, well, what if? I need you to stop. Guys, I'm speaking to you from experience. I have been in emergency medicine since 1998. Some of you weren't even a glint in your parents' eyes. Your parents probably didn't even know each other. They might have been high school sweethearts. What?
He was just looking at me and I was telling him I was born. I was very alive by that point.
I know that some of this stuff is not real world. I also know you have to pass the NCLEX. So I'm teaching this from 2 different angles. I'm trying to make you successful on the NCLEX. Guess how my test is written? Like theirs. I need you to listen to me. Because every semester, every AMED student that's in my class is in my office upset because they didn't do as good on the test. Guys, when I was in nursing school, I failed my first test miserably, and I'm like, oh my God. I had a 4.0 in paramedic school, and I'm like, what happened? What? I'm not an idiot. What happened? I didn't have anybody to talk to me to tell me what I was doing wrong. Please don't put what if. It's going to make you miss the question. Yes, ma'am.
Could you, okay, I'm like the worst overthinker ever and I make everything more complicated than it needs to be, so could you give an example of like what you mean when you say like what if questions, like how you would see it?
Just raise your hand on the exam. I'm just kidding.
Like adding the question.
So just like going with what you know.
Yeah. Just read the question and take whatever's on there into account.
Okay,
Don't
hold on
say,
just a
like,
second,
what if this
because
happens?
there was this question
So I'm
that
one
I,
of those people who's like, did this get done? Did that get done? What was on that before this happened?
Yeah.
You know, what am I missing? Like, did they do this? Did they not do this? That's the what if. Before I answer your question.
okay,
Instead of just
you and your partner are both paramedics and you're getting somebody out of the house, patient's on a stretcher. So you're going to lift the patient. I'm here, partner's here. As you're lifting, your patient, your partner yells out, "Oh my God, my back." What are you going to do first? Stop the lift? Go over and assess him. "Oh my God, are you okay?" Check your patient.
Check your patient. Check.
Stop the lift. What do we want to do? What are you going to do? You're going to do all of it together, right?
Yeah.
What did y'all do when you said, "Check my partner"? You put your real world in there. Stop that. I know you're going to do all of it together. I realize that. That question is not real world. Test world. And when I'm talking to y'all, sometimes I'm sitting here, and guys, I'm not losing it when I'm sitting here doing this. I'm trying to think test mode. Now, sometimes we do things in clinical mode that we ain't supposed to. What's it called? Cutting corners. And we develop bad habits. I'm going to beat them out of you if I see them. It's not evidence-based. And that's a big thing with me. Guys in EMS, we ain't got that down. Nurses, EMS is a new in 1973 was kind of when that was the year I was born, 52 years. Nurses have been around since caveman times, like really. See, I said it down. I remember where it was. It's a clinical setting. NCLEX module. It is a perfect world. You have got every resource you ever dreamed about. You're going to get every IV. You going to get that in clinical world? Hell no. You have got every resource. Every order is already given. Guys, I'm not going to give you a question where you're like, "Oh my God, do I have a..." Is that fair? It's not. I'm not going to give... And y'all are like, "She's going to trick me." I'm not. I promise we didn't write questions that are so close you're like, "Oh my God, I don't know how to choose." No, that's not fair. You will get every IV stick. You will get every blood culture so that you know how to make that choice. If there is an answer that you don't have enough information about to make a choice, which answer is wrong? That one. If you had to if you had to put other shit in there, is that answer right? No. If I said the patient's breathing 32 times a minute, and I didn't say it's labored, it's whatever, they've got gurgling, I didn't tell you there was any problem with it. They just might be breathing 30 times. Do you see what I'm telling you? If I said they're breathing 32 times a minute, and you're saying, "Well, that's way too fast. They must have stridor. There must be something wrong." What did you do? Guys, that's what you've got to do on the NCLEX. You have got to get that in your mind. This class is the worst about doing that. And by the time y'all get to Adult Health 2, 99% of us are working in healthcare. And that first test is devastating to us. It was devastating to me. I think I went and drank a lot. Jack, Jim, and Jose. Mm-hmm. So I'm trying to forewarn y'all. I have got to where now in Adult Health 2, before the first test, I pull every person aside that has any experience. Because I've learned, I want to try to hit it off. Is there any question in nursing that's never, always? No. Guys, get rid of that answer. Don't even look at it again. If I don't quantify that answer, don't add nothing. How do we do this? A, B, C, D. Now, what's on the bottom of Maslow's? A, B, C, D. Guys, I hate disability. Y'all saw what I added in there. Don't remember a damn thing. I don't know why I don't like that word. It makes me think about disabilities. It is an altered level of consciousness. They're A and O times 1. They're unconscious, unresponsive. What else is down there?
Extremities.
Exposure.
Yeah, exposure. I'm talking about in Maslow's.
Same
Oh.
Food, physiological need. What else?
Safety.
Safety,
belonging.
belonging. So, no, that's way up.
Relationship.
Sleep.
Y'all go ahead and say it. Sleep is down there. Relationship. It says something else besides relationships. Sex. Y'all can tell me sex ain't important if you want to. It don't say ACS. If you ain't breathing, you ain't worried about sexy time. I promise. If safety does not come before airway with your patient, can safety come before airway for us? Unfortunately, it might have to. If somebody is shooting at you, you can't try to save your patient. Because now, you're a patient. A, B, C, D, E. Everything after that. Safety is in there, yes, always. And it's not always our safety. Another way, and we just talked about this, that we can break this down is the nursing process. Guys, it's not that I don't care about the other parts of this, but you know what they figured out in nursing diagnosis, and you will not hear me say that word. I always, Dr. Wilt would kill me. I thought that was stupid. I want to hear your words. They having trouble breathing. Okay, what do you think the reason is? And you could tell me, well, you know, a COPD, they're trapping all this carbon dioxide. I get that. You just told me what? The pathophysiology. And we could go down that. Ineffective airway clearance. I want to know your words. Well, what if I don't get it right? Okay, we'll go look it up together. I don't want to know their diagnosis. I want to know what you think. They figured out the nursing process is linear. Is anything in our world linear? No. But this has to happen this way. We do not intervene before we assist. What if it's a catastrophic bleed? You had to see it was a catastrophic bleed before you could put a tourniquet on. Right? How do we assess? Look, listen, and feel. Yes, ma'am.
Okay, so, and I'm just playing devil's advocate here. When we were in skills fair yesterday and we have an unconscious patient rolling in and we don't know why their heart stopped or anything, and we listed all the things that we can do to restart the heart and Narcan them because it won't hurt. Well, we're doing an intervention without knowing if that's what's going on.
But you've already assessed A, B, and C.
Well, I mean, that I was saying that because if they're coming in and you had said EKG before nitro, wouldn't you? I understand you want the EKG, but wouldn't you give the nitro as you're hooking them up just to stop it if it is a heart attack?
But how do you know it's a heart attack?
Well, you don't, but how do you know that their heart stopped from an overdose?
You don't, but you did your assessment. You've already done A, B, and C. Airway, breathing, circulation, and cardiac. You've already done all your assessment. You're not going to give Narcan first. You're going to follow ACLS protocol.
Okay.
That may be way down there. You've done all of your assessments.
Gotcha, that was just like,
Yes.
is there anything else that you could?
Is there
think of
anything
that-
else? And so, let me throw this at you. You did your H's and T's. What is that? It's an assessment. Even though it's a verbal back and forth, we're still assessing, is there anything else that you can think of? Right? Well, we done got down through here, we ain't figuring nothing out. Are they unstable? Blood pressure's kind of soft. They ain't yet, but about 5 minutes from now they might be, right? Well, what is this? Can it be both? Somebody give me an example.
So the COPD has been exacerbated.
There you go. I done had the COP, I done had the difficulty breathing the emphysema for a long time. And it's during the summer, and it's 105 degrees, and the air conditioning at Tanova is out. And I come in, and there's something on there that says expected and unexpected. What would you really figure that their O2 sat would usually be? It'd be 88, 90, and you could ask them what is it normally? If they've had COPD, they'll tell you. But at 75, is that expected? No, they're wheezing bad, diaphoretic, acute on chronic. Patient had congestive heart failure, have had it for years. Got septic for some reason. We'll just say pneumonia. So, comes in, has this pink frothy stuff coming from their mouth. What is that? Pink frothy sputum coming from their mouth.
Pulmonary congestion.
Flash pulmonary edema. Acute problem? Yes. They had congestive heart failure, got sick as shit. What has it done to their congestive heart failure? It's made it bad. Their heart is really failing. It's backed it up into the lungs. They're having flash pulmonary edema, which is going to kill them. Guys, if y'all see that coming out of their mouth, you better do something. They're going to die. They're probably going to intubate them immediately. Is this normally, if you have a patient that comes in and they're just admitted, they had surgery, they had their gallbladder out. Man, my pain's bad. It's a 6 out of a 10. Is that normal? Yeah. If they come back and it's like day 2, and you walk in and they're sweating and like, oh my God, my pain is a 9 out of a 10, and they've been getting oral meds and their temp's 102, that's not expected. Fresh out of surgery, maybe. If they say it's a 50 and they're not like, you know, if it was a 5 before and now it's a 10 and they have a pain pump, first you need to look at the equipment, right? Then you need to look at the wound. Is it really going on, or might it go on? And I put that on there high.
It's that important.
We already discussed it. Guys, if y'all need a break, you want to speak up?
Can I have a break?
Yep. Go.